Hi viewers, I'm Gayatri working as an assistant professor at the Department of Psychology. Today my case study is Generalized Anxiety Disorder. GAD, Generalized Anxiety Disorder. Generalized Anxiety Disorder is characterized by persistent, excessive and unrealistic worry about the different matters ranging from personal life, academic life and occupational life. The worry is an excessive and difficult to control and leads to many psychological and physiological symptoms too. Then I have mentioned some causes of GAD. Worried, anxious, nervousness, tense hacking or painful muscles, restlessness, unable to relax or sleep, easily distracting, easily irritated, easily fatigued, unable to control their worries. This is all are common causes of GAD. Apart from this excessive worry, Diagnostic Statistical Manual for Mental Disorder DSM-5 has also stated this excessive worry is difficult to control and should have at least three or more physiological and cognitive symptoms such as restlessness, easily fatigued, difficulty to concentrating, muscle tension, sleep disturbances, and irritability. So stress is one's life. So the physical conditions such as diabetes on stress, genetic factors and environmental factors such as child abuse and substance dependency are also important etiological factors of GAD. Case studies. In 2013, the patient's problems became evident after his father's death. The patient felt extremely distressed as he was much close to his father. The patient reported that after a few days of his father's death, he remained worried. He was uneducated and jobless, which made him worry about him and his family's future. Mr. X was unable to control the body and he felt that if he wouldn't stop worrying, he would lose his mind. This caused as a decrease in his sleep and he started experiencing muscle tension, especially pain in his shoulder. He affected in GAD. His parents considered about his marriage, but he was not accepted because he last 5 years faced only the failures, so that's why he was not accepted get marriage. So this kind of patients, what are the treatments, it will be very effective to cure this kind of disorder. The treatments are cognitive behavior therapy is one of the most effective way of treating various disorders such as depression and anxiety. It has been indicated that CBT and its exposure based modalities are effective to treat anxiety disorders such as GAD. Cognitive behavior therapy includes techniques like verbal challenging for cognitive restructuring and behavioral experiments. In addition, relaxation exercises are also used to treat symptoms like fatigue and tiredness. During this initial session, psychoeducation was done to develop an insight about the disorder as well as the etiological and maintaining factors. So further, verbal challenging exercises were done which mainly include the techniques like questioning the evidence, a cost-benefit analysis, questioning the mechanisms, selling the meta-wording and challenging uncontrolled appraisals will be provided. Whereas behavioral experiments include suppression experiments, controlled worrying period, loss of control, worry experiments, and pushing worry limits in situations we can provide. Then case conceptualization on a metacognitive model of GAD. Metacognition means is an awareness of one's thought processes and understanding of the pattern of behind them. Triggering factor, thinking about unsuccessful marriage life of Mr. X. Worrying will keep him safe. If he don't worry, he won't be able to cope and he is in a jobless conditions. He won't be able to get married because of joblessness. So if he get married, it won't be successful. He should look for a stable job and good salary. His wife will be accepted if he in a good job. So then we can apply into an emotional state. Negative emotional states like restlessness, sad and anxious. Then worrying is an uncontrollable. He will damage his body and muscles because of lot of worry, excessive worries. He would lose his mind worrying. So what are the factors is affected? Behavioral factor and thought control. What are the behavioral factors is very helpful? Tried sleeping, went out for a walk, smoking cigarette, read job advertisements in a newspaper, avoided marriages, marriage topic, and thought controls like suppress initial thought, allowed worry to continue once again. Then intervention. Some intervention techniques has to be provided to the patients. Session 1, presenting complaints. GAT related complaints has to be calculated, and a history of presenting illnesses, and a mental status examination has to be over. The rapport building will be started and educated to a breathing retraining exercises. And session 2, completion of the history and assessment of the problem. What are the problem? Identify the problem, then we can ready to start assessing. Then differential diagnosis and finalize the diagnosis also finished during session 2. Breathing retraining exercise will be provided and worry thought recording will be continued till end of the session. Again, we can provide the homework of breathing retraining exercises. Then session 3, homework was reviewed, prepared the agenda, elicited type 2 errors, especially guiding the questions, advantages and disadvantages of analysis, identifying the control behaviors, applied relaxations. The first sessions we can review, then we can again apply the relaxation techniques, and counting the worry thought recording. It will be provided as a homework. Session 4, homework was reviewed again prepare the agenda, then idiosyncratic case conceptualizations will be over during session 4. So which means as a unique case conceptualization, the process of placing an individual's idiosyncratic experiences within a cognitive behavioral framework. So the next one is a socialization experiments, that is thought expression, thought suppression. So what if experiments? If we are provided suppression experiments, we can measure and we can analyze that. Again, we can apply the relaxation techniques. Then session 5 and 6, agenda will be prepared, modifying the negative beliefs about meta worry through verbal reattributions like questioning and evidence, questioning and mechanisms, challenging uncontrollable appraisal will be educated. Then session 7 and 8, again prepared the agenda, homework was reviewed, behavioral experiments in order to disconfirm the negative beliefs related to worry, that's like controlled worry periods, challenging uncontrollable beliefs, and a loss of control experiments will be provided. Then a 5 and 6 session, we can provide applied relaxations, and a mini survey to normalize worry was given as an homework. Then 7 and 8 sessions, surveys will be made. Then session 9 and 10, homework was reviewed, agenda settings will be made, modifications of positive belief about worry, especially verbal reattributions, and we can provide homework of worry abandonment experiments. Then session 11 and 12, so agenda settings will be made, relapse preventions will be provided, then review the homework of worry abandonment experiments. If we over successfully of this 12 sessions, it's very helpful to cure this kind of disorders. Thank you for watching.